Should I
This
wear a mask
conference
all
will
day?
now be recorded.
Oh, there we go.
Okay.
Kristen, this is Bob Davis. Are you there? Can you hear me?
I am. I can see you all.
Jim, I can see you. And who else is here?
Diane Bean.
This Dave Rayleigh.
Sharice Hoskins.
Sharice, Kathy, Dr. Bolin is here. Mr. Todd, Kathy, Dr. Carter.
Okay, well,
Okay.
do we have 6 board members?
Can you hear me? Can you hear me, Kristen? This is Diane Bean.
Yes, ma'am, we can hear you.
Okay, it's really breaking up pretty bad.
All right, let's take roll call one more time, so to see how many we've got there. Bob Davis is here, Dave Rayleigh, Diane Beam, and who else on the board?
Ralph Carter. Bowling.
Pardon me?
Bowling.
Dr. Bolin, are you there?
Yes, sir, right here.
Okay. All right, who have I missed?
Did you see Dr. Carter?
No, I've not seen him.
Yes, he's on. He's on.
I'm on, Bob.
Okay, all right. I need one more to have a quorum. Mr. Todd, are you on there?
Mr. Todd is on, yes, sir.
Okay. All right, then I will declare a quorum and call our August 18th board meeting to order. And if you will, bow with me in a word of prayer, please. Our gracious God, we thank you for the opportunity to serve you each day. And we thank you for the opportunity as well to serve our fellow man. We just ask that you would guide us and direct us and keep us safe in all this virus, and be with each citizen of our county and guide and direct them, and help each of us to be aware of our neighbor and to take care of each other, and to continue to be safe, to wear our masks, to maintain social distance, and to wash our hands, and try to encourage everybody else to do the same thing. We just ask that you would guide and direct us in all that we do, and any decisions that we make here today would be in the best interest of each and every citizen of Scotland County. Amen. All right. Then I would entertain a motion to approve the agenda or revise the agenda, and I would like to revise the agenda to include approval for the new labs and the receipt of funds that were approved by telephone or by the computer of the board, and there were 7 of those. And I would like to just include those in as to approve them when we approve the agenda, if that would work.
So moved.
To have a motion, need a second?
Second.
I'll say.
Okay, have a motion and a second. All in favor, let it be known by saying aye.
Aye.
Opposed, like sign. All right, then we need to adopt the agenda. Need a motion to adopt it.
So moved.
Have a motion and a second. All in favor, let it be known by saying aye. Opposed,
Aye.
like sign.
Aye.
All right, I need a motion to approve the minutes.
So moved.
I don't know which minutes we're approving there, but anyway, they're down here somewhere else. But anyway.
Mr. Davis,
Yes,
those
ma'am.
minutes are down there in the unfinished business section.
That's what I was saying. I think they're further down, so we'll go by those and see if there's any anyone wishing to make a public comment. If not, then we will go to the administrative reports, and Tim, that brings you up.
Yes, sir. Can y'all hear me?
Yes, sir, I can hear you.
Okay.
Yeah.
This is the financial update as of June 30th, 2020. This first slide that you're going to see is the 10 essential functions of public health. And the reason for this slide is because per accreditation, anytime we talk about budgeting or funding, accreditation requires that you all guys as Board of Health understand the 10 essential functions of public health and what goes into funding those functions. So this slide is basically for your benefit for accreditation purposes. Any questions on that?
Any questions for Tim? Okay, go ahead, Tim.
Okay, next. So we're going to talk about the previous fiscal year, 1920. You get so what you'll see here on these slides are that as a total, the health department, we are 7.7% under budget last fiscal year in expenses. So that is $235,012. $276,029 under budget from for last year. Any questions on that? Okay, next. When it comes to revenues, for the whole year, we are currently at 98.4%, so we're under budget by 1.6%. For revenues, I will say, since I have been here, we have never been under 5%. So we're at 1.6%. So we've done extremely well this year in the midst of everything still going on. The first of the year before COVID happened, we saw lots of patients, and those numbers have gone up. Plus, we got additional funds for a Medicaid cost settlement as well. But overall, the agency has done wonderful in collecting revenues this past year. Any questions on that? Okay.
We're good.
All right. Next slide. This shows you where we are collecting clinical and environment health revenues this year versus the past 3 years at the same time. As you can see, in almost every program, save maternal health and TB, we have overperformed what we've done in the past 2 years. Family planning services, you can see, is almost doubled what we've done in the previous years. Any questions?
Our immunizations, Tim, they are way up too, looks like.
Yes, sir. We've done a lot of flu shots this year, more than what we had previously done. Plus, we're doing these private immunizations, and it's going very well.
Well, you're going to get another one. I got to come down there next week and get some shots.
Okay.
When
And
will the flu shots be available this year?
I will have to defer to Donna on that question.
Hey, usually we get those in late August, early September, so I'm thinking soon. I don't know an exact date at this point in time.
Okay.
And the other slide, the last slide you'll see, this is the overview. This lets you know how well we've done for the whole fiscal year. Like you saw on the previous screen, we had $40,000 that we had not collected, but we had $276,000 that we were under budget with. So that left the health department at a excess of $235,112. That means we done a really good job budgeting our money and collecting revenues. So whatever the county decided to put in our budget, we exceeded, we had just 235,000 less than what the county had budgeted. Any questions? Okay. Thank you so much.
Thank you, Tim.
Thank you.
Anybody have any questions of Tim? Okay, then we'll move along to the monthly activity summary. Kristen, you gonna do that?
Yes. So good evening, everyone. This is the activity summary for June and July. And if you notice on July, we did not receive the Humane Society report, so that's why we didn't have the calls and the impounds for the Humane Society. Next slide. Okay, so the administrative report. So basically, everyone knows since COVID, everything really shut down. But since March of 2020 until the present, Donna, myself, Alicia, and Shakila, we've been providing technical assistance to Scotland County clients and citizens. And myself and Donna, we've provided guidance to the school system, the hospital, long-term healthcare facilities, such as nursing homes, and county agencies, organizations here in Scotland County about COVID, how to prevent COVID. If they've had a positive case within their organization, they call us and we provide them with technical assistance. Also, I was asked by the state of North Carolina Department of Health and Human Services to take part in the media review for the state. And it was myself, Dr. Zach Moore, and another health director. We were actually talking about COVID and contact tracing, and they were pretty much asking how is it that Scotland County is keeping our numbers down. And we just tell, and basically I was explaining our method, how once we find someone who's positive, of course we ask about their contacts, and we make sure that we isolate the person who is positive for COVID, but we quarantine all of the contacts for the 10 to 14 days, or whenever the positive case, once they recover. And so we went in, we just pretty much discussed contact tracing on that call. Also, I give updates to WLNC on Sundays and Wednesdays about the COVID numbers and any other updates that I think that the county may need to know. And also I update the Board of Commissioners every month. And also, I've taken part in the graduation. As you all know, the graduation, it wasn't a traditional graduation for Scotland High School because of COVID. So we came up with a plan with the parents and the students on how graduation was going to look for 2020. And so, of course, it was like a drive-through graduation. And also, I've taken place in the reopening of schools and the reopening of businesses with RCC, myself and the health director from Richmond County, Mr. Tommy Jurrell. We helped the businesses in Scotland and Richmond County develop a plan on reopening their businesses in phase 2. Also, there was two testing events that Scotland County Health Department had taken place within the community, and one was at Nazareth on July the 18th, and the other testing event was July the 24th at Bethlehem Church, and both were a success. And during this pandemic, we were dealing with the pandemic, but we also were dealing with the retirement of Brian Lowry. And so with that brought challenges because we had people wanting or needing septic tank permits. So we had to contract with two other agencies with Robeson County and with Hope County to help us mitigate those problems. And not only did we lose Brian, but we also lost Andrew. He was an environmental health specialist, and Savannah Simpson, who was the health educator. So what happened, we began to hire. So we've hired a new WIC director, a new nutritionist too. We've hired a environmental health supervisor. We've hired another environmental health specialist and a health educator too, which would start September, I think the 3rd. And we only have one vacant position for environmental health specialist because Valentina, she became our environmental health supervisor. She was a specialist 1, but she's now the environmental health supervisor. So that, and the environmental health specialist position, it will close on August the 29th. And we're hoping that we get some great candidates and that we can have that position filled, and knock on wood, once we get that position filled, all of the positions within the health department will be filled. That's my report.
Okay, thank you, Kristen.
You're welcome.
The committee report, who's gonna handle those?
Oh, all of the supervisors will do their report as if we were in the Board of Health. So Donna,
Okay.
Hey. So clinically, as Kristen said, we've had to make some changes inside our building, open up the education room to allow for screening of everyone that came in, but we have continued to provide services and patients continue to come to their appointments. It's kind of amazing to me that it seems like they must not have anything else they can go do, so they come to get their appointments now. So we have been continuing to provide services as we normally do. We just had to make a few changes. Staff members are taking turns covering the table down in the education room along with the WIC staff. So it's been different. It's been different, requiring all the people to wear masks, and when they come in, if they don't have a mask, we give them a mask. So we only let the patient come back unless it's a special circumstance. So we're doing what we can to continue to see do the services, and luckily most of our people in our building have been healthy through all this. So I mean, we've had a couple of scares. It's been good. So the clinical report is, so we had some members that attended a family planning webinar in March. Kristen and Jessica and myself met with Al Bishop about our RHCC contract for our EIC and Ryan White funds. And at the end of this contract with them, we will be changing over to another Ryan White provider. We won't have a contract with RHCC anymore. And, I think that'll be a good thing. And now that we have actually hired a child health nurse, named Michaela Hunt, and she, Carlotta has been filling in and doing the child health thing. So Carlotta has been attending all the child health webinars. We are still required to do that, even though the world has come to a screeching halt in most places. Carlotta also provided a child fatality report to the county commissioners at one of their meetings. And we celebrated Lab Week and Nurses Week. And we had 4 nurses who attended and completed HIV counseling and training via webinar. Next. Members of the child fatality prevention team participated in the child death due to prematurity. Elisa and Clarissa is our immunization nurse, attended a GlaxoSmithKline webinar, vaccine webinar. And, you know, schools are opening. There's a new requirement for a vaccine for high school students this year. So we've been trying to advertise on our webpage and Facebook to make sure parents know that they can come in and get their children vaccinated at the health department. Nobody else does it better. And myself, Alicia, and Shaquila have been working with the COVID cases. They're the two new communicable disease nurses. So through all this, they've actually had trial by fire, as I have too. And so we've had to learn together through all this. And Miss Patterson has really been instrumental in her history and experience, has been a great help during all this. She'll jump in and call people and do things for us, but she's helped a lot being able to keep the cogs of the wheel working together. And so we I think up until now, us three have been doing good, and with Miss Patterson's help, and I pulled another nurse in, but it's getting to a point where we're reaching out for some more help. Miscellaneous updates. Of course, we went through accreditation with honors. I don't know if we talked about that at the last meeting or not. I think we went into lockdown right after our accreditation was, and then of course Ms. Patterson and I both participate in weekly COVID calls with the state, and then we have a local EOC call every Wednesday that is opened up by ruling over at the EOC. Next. Social workers, Betsy participated in a care management supervisor's webinar, and she also attended PPAT meeting. And a lot of these things are continuing because they're able, everybody's gone virtual and been able to do webinars instead of putting everybody in a room. So some things have actually kept going. We did have to cancel our breastfeeding and childbirth, breastfeeding and parenting classes, unfortunately. There was just, we have a room full of people, and that was completely against the rule. All the social workers and Carlotta attended the child fatality prevention team webinar. Social workers completed multiple continuing education webinars. And Betsy, who is our supervisor of the child care management and pregnancy care management, those programs have been through so many things. I remember them way back when they were called. This is the third name they've had since I've been in public health. So, but they had a wonderful review, even working virtually. They're still trying to talk to their patients and make those contacts. So they actually exceeded the benchmark by 3% in her program to engage all the clients. There's a benchmark, and they exceeded that by 3%. And so that was great. And Betsy attended a foster care children's conference call. Next. And this is just what I wanted to, I put some information in your packets that went out about COVID-19. And I want to say, up until now, usually public health is like the silent guardian, but everybody knows who public health is now. At least through this, they know who we are because they know. And so it's great. I mean, they're reaching out and asking for guidance, and that's great. And I think everyone has done a great job in trying to work through this pandemic and be sane at the same time. But let's see. So Kristen's already talked about us partnering with the two places, and I did put on the slide, there's 210 of those that were tested were Scotland County residents, and out of the 210, 3 were positive. Now, that first site we did in Wagram, they tested over 200 there, so there were other people besides Scotland County residents, obviously. Now, just a little update. As of yesterday, 6,816 people have been tested. I just did another report. Let's see what it went up to. No, it hadn't went up too much more, but I did the 3,844 in the past 30 days, and just the outbreaks that are in our community and long-term care facilities in Scotia, Scottish Pines, RHA, and RHA has several locations, and since all this has started, they've actually had an outbreak in 2 of their locations. One of them was in the Maxton one, and this one's in town, College Park. Local churches are having some what we call clusters in their Northview. Harvest Ministries has really had a lot of cases. Chosen House of Deliverance, Huckabee Grove, and Peace Holiness. And also Scotland Correctional. As of yesterday, I think I seen another one today, so they probably have 23 confirmed cases today. The results of the outbreaks at Goshen, Scottish Pine, and Scotland Correctional, they required them to mass test all residents and employees. And their criteria as they test, they have to retest all the positives, and they have to over a 2 to 4 week period. And then after they have all negatives, finally, from all their employees and staff, residents, then they'll test, they're going to automatically retest the staff every 2 weeks. So once they get that negative, they're trying to put a block on, they know it's coming from outside in the employees. So once they get their residents straight, then they'll have the employees tested every 2 weeks. And that way they can keep a little closer handle on positives in their staff. And then, of course, with the prison, that's, the governor ordered mass testing, and they found out they had a lot of cases. But one thing about Scotland Correctional is it's a hub. So a lot of prisoners that are positive for coronavirus go to Scotland Correctional. They're transferred from Caswell County, all over the place, Robeson County, and it's because they have the room to house those inmates individually, where a lot of prisons apparently do not. So they send them by the threes frequently to Scotland Correctional. So that they've had 22 confirmed cases is actually amazing to me, that it hasn't been a lot more than that. Because
And I would second that statement. When I saw that number, I was surprised that there's not more than that out there.
I think they do. I've had, we have patients, inmates, family members call regularly complaining about the prison, and that, they're not keeping the sick people apart. And I know that they've done I think they've done a great job with keeping 22 confirmed cases there. They did have one death of an inmate. But the way that it works with inmates, they travel from prison to prison, and so their address changes with the prison. So everybody that they move into the prison that came from another county, that case stays with that county. Count that as a Scotland County case until they test positive, a new positive in their facility. So the 22 are actually cases that have been housed at Scotland and somehow have been infected, not ones that have been transferred in.
Donna, do you know how many inmates there is at Scotland Correctional?
If I was at work, I could tell you, because I have a outbreak report form that I do. Let me hold on. I got it. I got NCEDS pulled up. Look. I'm thinking it's in near 6,000, maybe. That's what I'm thinking. If I can remember correctly, I believe it's about 6,000. Yep. It's
Out of Scotland?
Mm-hmm. Yeah. I can't get to it real quick right now.
That's okay. That's okay. I just thought you might remember.
Yeah, I'm thinking it's close to 6,000. I'll look it up when I get off my turn, and I can tell you later.
Okay, thank you.
Okay, next. And this is just an update, and this is the way the new updates that we send out every day are going to look. So that was yesterday's cases compared to what y'all have now. It's probably a little bit weird. Today, when I left, we had 454, and when I got home and checked, there was 470. Just when I left work until now. So lots, it's increasing. It's like the numbers in the state and the nation go down, and we're going up. It's really bizarre. It was the other way around. When everybody else was going up, we were holding steady and staying low. Now it's flipped positions. Yeah. And we now have 8 deaths instead of 5. Yeah, that changed today too. And most of all those deaths are 69, 74, 81, 83, 90, 91, 93, 94 are their ages. So everybody's over 65. Yeah. And 3 of those are from Scottish Pines. Next. And this is another graph that, from your graph last week. I think we had 37, and this last week there were 73 new cases. That's the most so far. Next.
Okay, so I'm gonna do management support because Ms. Deb had to leave. So basically, Gwendolyn Clark and Ms. Deb, they attended a lunch and learn for HIV. Ms. Deborah Rogers completed a youth-friendly environment webinar. Gwen and Ms. Brenda Tyson, they attended a heart meeting. Management support staff completed several webinar trainings, and they've had their monthly meetings. And Ms. Deb, she completed a United Language Group virtual meeting, and the staff, management support staff, they also had an update with billing. So Jennifer and I think Ms. Deborah Kersey did an update with them on the billing. Next. And the WIC report will be done by our new WIC director.
Hello, good evening, everyone. My name is Trish Austin. I'm the new WIC director. We have a very big support because between March and June, we had very limited community outreach. We normally go to the hospitals, we go to the Head Starts, we go to the schools to make sure that parents know the resources that WIC has available for them. We've been unable to do that since COVID. But we do plan on starting a Facebook page so that you can reach us through the internet. That's a big hit on the Scotland County has a Facebook page, so we're going to see how well that works out for us. We did hire a new nutritionist too, Kim Brown. She's been doing splendidly so far. Yesterday, she saw 32 people, like herself, accompanied by, Douglas Rogers. The clinical counselor has maintained doing online courses. We went to Chapel Hill for the 9 participants that are consistently coming. So we are seeing that we have people who are dedicated to the breastfeeding peer counselor program. And we did see a generous donation of diapers, wipes, and other miscellaneous infant products from the former health educator, Savannah Simpson, prior to her leaving for any of their families in need. Next.
Good evening, everyone. This is Kathy Cox. I did combine my May, June, and July activity numbers. So for the outreach, even though that looks like a large number, each month has been sort of lower numbers and the participants lower, but because of our COVID events that we participated in, increased our numbers to 500 plus. Now, these are actual participants in programs or activities that we are providing. But as you'll see, also for the other outreach, I'm not going to go into everything because I know you can look at it, but what we do is either provide educational materials, resources, we provide information through our exhibits, but also through media and social media, meaning the radio station, which we go to once a month, as well as social media on Facebook. And I have to say I'm very excited, not because of the COVID, but because of COVID, we are getting over 1,200 to 1,300 views on our social media almost on a daily basis. And they are very respectful and happy with our COVID-19 information, the education that we're providing, the numbers that we're providing, because it's Scotland County information. And some of the highlights for social media, not to go through everything, but you'll see the main ones that we are providing are on COVID, about opioids, tobacco prevention, heat-related illness, and also, let's see, what else? Well, you see heat-related illness. So those are some of the main important social media education that we're providing, since we can't actually be out in the community. For trainings, I will say that's most relevant has to do with COVID, opioids again, tobacco prevention, heat-related illness, as well as child passenger safety technician training. That's for my recertification. So there's a whole lot of trainings that I've been participating in through webinars versus us going out, virtual meetings, those kinds of things. And so for other, just to highlight, is that we are still working through our Healthy Communities grant-funded programs. I did turn in our fourth quarter report to the state. I'm excited to say that we did get an approval letter for our community health assessment that was turned in, receiving 100% of our accreditation benchmarks. And also work is beginning on our community health improvement plan. And so those are the highlights of the things I wanted to just share with you all. And detailed monthly activity numbers and updates are available through me if you wanted to take a look at those. Any questions?
Anyone have any questions for Kathy? Kathy, thank you.
You're welcome. Thank you. Ms. Patterson, do you want to share about the ICO for MCH?
I can do it. So we have ICO for MCH, and that's Sanquise. She does that program, and now our ICO for MCH is now with Montgomery County, Richmond County, Hoke, and I think that's it. Yeah, so we're in our regional collaborative, and so the focus is breastfeeding, and Sanquise has worked with the our WIC department with the breastfeeding, doing completing webinars, and also with Triple P. She goes to Richmond County and she works with the health educators there. And also with this Triple P, they have developed a peer-to-peer trainer. And so these trainers are going to actually go out once we can go back out and do outreaches. They'll be doing the outreach to educate other young people. And so pretty much everything is really on hold right now, but they are receiving training. And also the community health staff is actively recruiting those candidates for the community health workers for the toolbox, to develop the toolbox for success. And so really ICO for MCH is doing a lot within the community and training other people within the community so that it can be sustainability. That's what they're working towards, sustainability within the community, because we know, like other programs, that's the goal. You have to be able to sustain the efforts that you're working towards. Next slide. That's it. Any questions?
Anyone have any questions for any of the presenters you've heard, or? Okay, then we've heard all the committee reports. Any unfinished business. We need to approve the February 18th, 2020 minutes. Do I have a motion to approve those minutes?
I motion.
Have a motion.
Second.
Need a second?
Second.
I have a motion and a second to approve the February 18th, 2020 minutes. All in favor, let it be known by saying aye.
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 Opposed, like sign. All right. New business. we need to approve, I guess, state funding in the amount of $127,846. And I believe I heard somebody say they approve. Have a second?
Second.
I'll second.
All right, have a motion and a second. Any discussion? All in favor, let it be known by saying aye.
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 Opposed, like sign. All right, any informal discussion? All right, don't anybody go away if you just stay with a few more minutes.
Bob, this is Ralph Carter. I just want to give you a little update from the hospital's perspective. There's a group of about 4 or 5 doctors and 4 or 5 administrators that meet almost weekly about what's going on with COVID. The hospital was overwhelmed this weekend by inmates. And that issue is that we are a secondary site. They move them here if they can't handle them in Raleigh. And then if they get sick, the correctional facility calls EMS and they take them to our hospital. And then that reduces resources for our community. So that is relevant to, what our mission is to take care of our community. We've raised objections with the state to say they need to have some mechanism to, if they have that kind of load, and they position these patients somewhere, these inmates somewhere near a bigger facility like a metropolitan area. So that's in the works. Calls are going back and forth with our representatives and whatnot. But it is an insight into, we got a little hospital does pretty good. We can get overwhelmed pretty quick by the half dozen or a dozen COVID patients, and we need to try to protect that resource.
Well, I don't know that it'll do any good, but I will reach out to our legislators and make them aware of it if they're not already aware of it, and see if they can help us in any way to relieve what you're talking about, Dr. Carter.
Yes, sir. Thank you.
Anyone else?
I have a question for the doctor.
Okay.
There's a hospital over in Hamlet that's been more or less shut down and abandoned. It's a modern hospital. Why don't they make that the COVID hospital for the area and take the burden off of the other hospitals?
There is some discussion. I think that place is already linked to the prison system to be used by the prison system, but I'm not sure about all that. And you're right, there's beds over there that we can open, but the issue is how are you going to staff them? We got a labor pool problem too. So, because we've had at the hospital one little outbreak, the patient we didn't know was positive, was in there for a different reason, and got a bunch of nurses sick. We lost about 10 nurses. You lose 10 nurses for 2 weeks. That hurts a little place with 100 beds. So you're right, that is a resource and it's being looked at, but I don't know much more detail than that.
Okay, thank you.
Any more discussion? Before we go away, I asked Sharon to email Dr. Boland, Charles Todd, Diane Bean, and Dave Rayleigh. Your appointments have expired, and if y'all would be willing to serve again on the board. So if you would respond to Sharon and let her know so we can get your name in the pot again. Is there anything else? Again, I would just
adjourn.
Okay, I would like to just thank everybody for their participation tonight, and especially thank the health department workers and staff, and Kristen for their devotion to our county. And as we all know, this is a a tough time for all of us. And I just ask that we all remain safe and take care of our neighbors. And I had a motion to adjourn. I don't believe we need a second. So if there's no further business, we stand adjourned.
Thank you, Bob.
Thank you.
Thank you, Bob.
Appreciate it. Thank you.
Thank you.
Okay, Rayleigh off.